Welcome to our presentation for Aboriginal and Torres Strait Islander Health, Assessment 1 Group Presentation. This presentation was created by Joyty, Jazz, Christina and Winter. Joyty was allocated question 1, the links between culture and Aboriginal and Torres Strait Islander health. Jazz was allocated question 2, social determinants of health that impact kidney disease, and Christina and Winter were allocated question 3, culturally competent and safe care in nursing. The categories we have chosen are remote for healthcare context, access to Aboriginal community controlled health services for the healthcare need, and kidney disease for the health issue. The aims and objectives of this presentation is to discuss the links between culture and health in perspective of Aboriginal and Torres Strait Islander peoples, to identify the social determinants of health contributing to kidney disease for Aboriginal and Torres Strait Islander peoples, and analyse how to ensure safe and culturally competent nursing care for Aboriginal and Torres Strait Islander peoples living with kidney disease in remote areas of the Northern Territory, and how access to Aboriginal community-controlled health services impact their health outcomes. Aboriginal and Torres Strait Islander peoples believe that the Western model of healthcare does not agree with their understanding of complete well-being of the person. They believe it only cares about the physical well-being of an individual and does not provide a holistic approach of total well-being. It includes all aspects of social, emotional, and cultural well-being of the whole community. Breaking the bond that connected Aboriginal and Torres Strait Islander peoples to the land and nature has eroded their identity, culture, and ultimately their health and well-being. Aboriginal and Torres Strait Islander peoples refer to country as a place that gives and receives life and incorporates the cycle of life, death, life. They therefore believe that everything is connected to the land and that the country cannot be owned, controlled, and manipulated for the survival of humans. Aboriginal and Torres Strait Islander peoples treat country as a living thing. They speak and sing to the country. They visit the country and have emotions for it. They also worry about the country and long for the country. Aboriginal and Torres Strait Islander peoples connect themselves to land by walking through country or being present on the country, or through stories, songs and dances for a specific thing, such as a tree or a river, or for activities such as hunting. For Aboriginal and Torres Strait Islander peoples, country is central to their health and well-being. In addition, this holistic concept of care for the country links them with their ancestors. The holistic view of health and well-being held by Aboriginals and Torres Strait Islander peoples encompasses physical, mental, cultural and spiritual health. It focuses on harmonised interrelationship between these and interrelating factors such as environmental, ideological, political, social and economic conditions. This spiritual relationship with the land is a fundamental connection that governs all other interrelationships with each dimension of health. It is believed that when all interrelationships are connected and strong, this then contributes to balanced health and well-being. In contrast, any disconnection from land and culture in any form can have adverse effects of the general health and well-being of the whole community. For example, Aboriginal and Torres Strait Islander peoples of Northern Territory believe that being present on the country is a physical activity. For them, traditional country or bush is an active, healthy place, and walking miles across the land to find bush food and survive in the bush is healthy living. They prefer this healthy way of living and associate their cultural traditions and activities as a way forward in overcoming physical and social health disadvantages. On the other hand, denial of access to the land is a major factor for antisocial, self-destructive, and stress-related health issues in Aboriginal and Torres Strait Islander peoples. Hence, this has a negative impact on the general well-being of the collective society and the land. It is common for Aboriginal and Torres Strait Islander peoples to refuse all or part of a treatment if it has negative impact on their social and spiritual role. An example of this is if someone has an injury or sickness and is unable to work. This means they are restricted to fulfill any social and spiritual task, and therefore the whole community is affected. Any individual problem is considered to be the community problem. In addition, the social stigma of sharing their health problem with someone brings shame to the individual. Unlike Western culture, shame for Aboriginal and Torres Strait Islander peoples is a powerful emotion and is greater than guilt and a sense of disgrace. Shame is experienced when an individual is disconnected from the group and ultimately from the land. These social barriers make it harder for them to get full access of the healthcare system and affects their healthcare outcomes. Hence, it is important to understand their concept of health and well-being to successfully help and treat Aboriginal and Torres Strait Islander peoples and improve their healthcare outcomes. There are many communities in remote areas of Australia where the people experience a high rate of kidney disease. Consequently, it is vital for those communities to have access to health services and social support networks. Kidney disease is a significant concern for Aboriginal and Torres Strait Islander peoples and is impacted through an absence of health services available to remote communities of the Northern Territory. Aboriginal and Torres Strait Islander peoples present with signs of kidney disease from the age of 18 in comparison to non-Aboriginal or Torres Strait Islander people where the average age is 55. Factors contributing to high statistics of kidney disease amongst Aboriginal and Torres Strait Islander peoples include a shortage of equipped and knowledgeable healthcare professionals working in remote areas, lack of affordability of healthcare services and treatment options, and poor awareness of healthcare services that exist. Access to health services in remote areas proves difficult due to extensive travel or the need to permanently relocate to receive treatment, which may not be financially viable. This has an extreme impact on Aboriginal and Torres Strait Islander peoples as they are often reluctant to act on their healthcare, which can result in kidney disease and ultimately end-stage kidney disease. During 2014 to 2015, end-stage kidney disease was the leading cause of hospital admission in the Northern Territory due to the lack of early intervention and health services readily available. Social support networks are significantly valuable to Aboriginal and Torres Strait Islander peoples and influence their health, well-being, and many elements of their life. These support networks consist of family, friends, uncles, aunties, elders, and other networks such as Aboriginal community-controlled health services. These vital relationships demonstrate the connectedness of a community and how meaningful social involvement impacts the growth and development of health. Aboriginal community-controlled health services aim to produce holistic healthcare and are empowered by the local Aboriginal and Torres Strait Islander community. They implement current healthcare strategies and incorporate traditional medicines to maintain cultural beliefs and increase life expectancy and overall quality of life. Aboriginal community-controlled health services have a crucial influence on Aboriginal and Torres Strait Islander people's health as meaningful relationships are formed, and the focus is not only on the individual needs, but also those of their family and community. Kidney disease presents a strong focus for Aboriginal and Torres Strait Islander peoples living in remote areas of the Northern Territory. A lack of education can lead to a misunderstanding of the severity of this disease and the importance in the initial steps to improve health and quality of life for those living with this chronic disease. Aboriginal community-controlled health services are networks that provide support in ensuring an understanding of health conditions in a way that the individuals can comprehend. These support networks aid in health promotion and early intervention for the upcoming youth who may be prone to kidney disease. An intervention that combines health services and social support networks for Aboriginal and Torres Strait Islander peoples suffering from kidney disease is the Western Desert Dialysis Purple House. The aim of this organisation is to administer dialysis treatment to people with kidney disease in remote areas of Australia. The clinic headquarters is located in Alice Springs, and a mobile unit known as the Purple Truck that travels to 9 additional locations to provide treatment. The Purple Truck allows Aboriginal and Torres Strait Islander peoples living with kidney disease to stay on country, to look after themselves and their communities, and be cared for by their families whilst embracing their culture and that which is important to them. In order to achieve a lower incidence of kidney disease among Aboriginal and Torres Strait Islander peoples, health services and social support networks must be available in remote communities to deliver safe and culturally competent nursing care. Registered nurses need to ensure they deliver culturally competent and safe care by developing an understanding of Aboriginal and Torres Strait Islander communities who experience kidney disease in remote areas of the Northern Territory. Cultural competency is the ability to understand, communicate, and effectively interact with people across cultures. Culturally competent and safe care requires nurses to be aware of their own world, develop positive attitudes towards different cultures, and have a sound understanding of cultural practices and other worldviews. Nursing is the prevention of errors and adverse effects to patients associated within a healthcare context. While healthcare has become more effective, it has also become more complex with greater use of new technologies, medicines, and treatments. Nurses who practice in a culturally competent and safe manner are able to understand and acknowledge Aboriginal and Torres Strait Islander peoples who are diagnosed with kidney disease as well as other conditions. This means taking into account not only the physical well-being of an individual, but also the social, emotional, and cultural well-being of the whole community in which they are able to achieve their full potential. To achieve a holistic approach to health, nurses should work in collaboration with Aboriginal and Torres Strait Islander peoples to ensure cultural safety. The disadvantages of living in remote areas for Aboriginal and Torres Strait Islander peoples are the ability to access information about their disease and treatment. Government funding plays a significant role in Aboriginal and Torres Strait Islander peoples due to the lack of transportation and access to healthcare services. Access to education and obtaining proficient knowledge and skills can result in improving health, culture, and respective minds towards individuals' health conditions. This can contribute to reduced adherence to treatment and increased illness and mortality for people already suffering a heavier burden of kidney disease compared to non-Aboriginal or Torres Strait Islander people. Lack of trust and relationship between clinicians and Aboriginal and Torres Strait Islander peoples can result in individual disempowerment and suspicion towards healthcare services. The attitudes of healthcare providers shape the way care is provided to patients. These include understanding of cultural views, patient-centred care, quality interaction of care, as well as an understanding where Aboriginal and Torres Strait Islander people belong. Healthcare providers must recognise their own culture as different from those of people they serve to ensure they do not impose their beliefs on the people they care for. Cultural safety requires healthcare providers to challenge their own stereotypical views of other cultures. It is about meeting people's requests, making them feel valued, and being compassionate and welcoming. It begins with cultural awareness leading to cultural sensitivity, thus enabling a trustworthy environment for Aboriginal and Torres Strait Islander peoples and health professionals who care for them. Consequently, nurses who base their care on culturally competent, safe care are able to promote the health and well-being of Aboriginal and Torres Strait Islander communities through respect, beliefs, values, and culture views. This is achieved by developing a relationship with the health government funding to support in making health services more accessible for Aboriginal and Torres Strait Islander peoples. This can be obtained through having Aboriginal and Torres Strait Islander health practitioners and employment for the community of the Northern Territory. Health services should design health promotion campaigns specifically for Aboriginal and Torres Strait Islander peoples and employ culturally competent non-Aboriginal or Torres Strait Islander staff to allow for more accessible services in remote areas. Health services should also be affordable for Aboriginal and Torres Strait Islander peoples who might otherwise not be able to afford them. It is vital to understand the concept of health held by Aboriginal and Torres Strait Islander peoples to improve their well-being and healthcare outcomes. Access to health services and social support networks must be available to ensure effective and efficient patient-centred care. This will contribute to a lower incidence of mortality and morbidity rates among Aboriginal and Torres Strait Islander peoples in collaboration with providing safe and culturally competent nursing care. Nurses are required to gain the understanding of cultural beliefs for Aboriginal and Torres Strait Islander peoples and their concepts of well-being. The detail of knowledge and understanding of social determinants of health for Aboriginal and Torres Strait Islander peoples can benefit nurses in relation to providing culturally competent and safe care. Patient-centred care is enhanced when nurses practice in a culturally competent manner and work in partnership with Aboriginal and Torres Strait Islander peoples. Therefore, nurses must be informed and knowledgeable of intercultural space for the application of culturally safe nursing practice.